welcome to another episode of Thought That Get Results. I'm Everett Weber Herbert, and as per usual, we are here every Tuesday evening with something that at least we think is of community interest and or of some concern. And if you think that you have something which fits into that category, you'd like to find out how you can be a part of the program, well, why don't you drop us a line, address it to a Let's Talk program in care of Vaughan Radio, P.O. Box 195, Charlestown in Nevis. So give us a call. Our numbers are 1-869-469-1616 and or 1700. And by the way, those will be the numbers you'll use to be a part of this evening's discussion. Again, thank you all again for joining us. This is your voice in the community, Thought That Get Results. With regard to your participation in the show, we encourage you to call in on the numbers listed, 1-869-469-1616 and or 1700. Here's a suggestion. You got a question or a comment, you can get a pencil, piece of paper, write it down so that when you get in the show, you're well organized. And you take as little time as possible so that we can accommodate as many of you as we can. We ask only, first of all, you respect yourselves and then respect others, because we will not accept anything we deem not within our broadcast standards. But always be forceful with your point. Again, thank you all very much for joining us. This is your voice in the community, Thought That Get Results. With regard to your participation in the show, we encourage you also to join us via our streaming on YouTube, and you can click on subscribe, click on our logo Vaughan Radio, or you can follow us by Facebook or Facebook page. You can see the video stream, and of course www.vaughanradio.com for our online streaming. Thank you all again. Tonight I'd ask everybody to join tonight, and if you think that your friend or your neighbor, somebody might have missed it, please ask them to join in. We'll be talking to some health officials about the coronavirus, and especially for our situation here in Nevis. Gary Pemberton is the administrator at the Alexandra Hospital. Nurse Jessica Scarborough is the assistant matron at the Alexandra Hospital, and we have with us also Dr. Hobson. So they'll be telling us not only generally, they'll be giving us the specific scenario as it relates to our situation here on Nevis and on St. Kitts. Mr. Pemberton, good evening.
Good evening to you, Weber, and a pleasant good evening to the listening and viewing audience. I'm Gary Pemberton, the hospital administrator. With me, I have Nurse Jessica Scarborough. She is the assistant matron and also the IPC officer at the hospital. When she gets a chance, she will explain to you exactly what that is all about. We also have Dr. Hobson. She is one of the physicians at the outpatient department, and she also will explain in her specific role as it relates to the current situation that we are faced with. We are all aware that the coronavirus or COVID-19 has grabbed the attention of the entire world, and as a matter of fact is actually in the backyard of St. Kitts and Nevis. So we are here to bring you pertinent information as to the operations at the Alexandra Hospital moving forward. So that's the reason why we're here, so that we can ensure that the general public will get the necessary information as we continue to prepare for for any eventuality in terms of we getting a confirmed case here or even a suspected case here in Nevis. So we have been preparing for the eventuality, and we will continue to prepare for this in the case that it will happen. So as I said, Nurse Scarborough is the IPC officer. We have Dr. Hobson is also here. So I will turn it over to Nurse Scarborough. She will just give us some pertinent information as it relates to our operations at the hospital.
Good evening, everyone. As Mr. Pemberton stated, I'm Jessica Scarborough, the assistant matron at the hospital, and I'm also responsible for IPC, which means infection prevention and control. Now, infection prevention and control refers to the policies and procedures used to prevent and or minimize the risk of spreading infections, especially in hospitals and human or animal healthcare facilities. It is critical to the health of our patients, healthcare providers, and the general public at large. With this in mind, we have established and we have enforced several protocols and procedures at the Alexandra Hospital. We're in the process of establishing a respiratory clinic. I'm quite certain that most of you who would have driven down the road would have seen a big change as soon as you enter the hospital entrance. That's where all our persons with respiratory issues will check in. Dr. Hobson will tell you some more about that when we get to her. We have also identified an isolation area, just in case we get a case, God forbids. And we have also identified a quarantine area as well too, for persons who may need to be quarantined. Personal hygiene. Now, one of the methods we are promoting quite greatly is the increase of hand washing. Hand sanitizers are strategically placed throughout the hospital, and we are asking that they be used before you enter the units or wards and on leaving the units or wards. We will continue to remind immediate family members who assist in caring for their loved ones, such as feeding, grooming, etc., to wash their hands before and after assisting their loved ones. If you are ill, please, especially with fever, cough, cold, flu, we ask that you do not visit. There are several methods in today's world in terms of communicating with your loved ones. We know you are concerned, and we also share your concern as well too. But if you are ill, we are asking that you do not visit. If you are ill, we ask that you call before you come. The numbers are 469-5473, 469-5474, and 469-5475. Once you arrived and you have a cough, if you are sneezing and you have a fever, you will be asked to wear a mask. Visitation for the hospital. Visitation to the hospital and the Flamboyant Nursing Home will be restricted with immediate effect. And it will be restricted to immediate family members and caretakers. We will also be limiting persons to one person per patient at that particular time for a period of no more than 10 to 15 minutes. I know this may seem short, but we are also protecting you as well too. We're protecting our patients, we're protecting our caregivers, and at the same time, we have an obligation to the general public to protect them as well. If you are visiting, you will also be required to log in our visitors logbook. We ask that you provide the necessary information that we are asking, as this will help us to help protect you and protect our patients as well as ourselves as healthcare workers. And this information will include your sign-in time, what time did you arrive, your name, your address. We need your phone number, name of the person you wish to see, the ward or unit that that person is on, and on leaving, we will also require that you sign out before you leave. You will also only be allowed, as I indicated before, to see one person, and that would be the person that you would have logged in to see. So it doesn't make any sense logging in to see Jack Brown, and then we find you by Andy Williams's bed. We will ask you to leave. That in itself is to protect you and to protect our patients as well. Visiting at the hospital or visiting hours has also been adjusted. Initially, we had a 5-hour, I think it is, visitation time, which was from 3 p.m. to 8 p.m. in the evening. We have adjusted that to 4:30 p.m. to 6 p.m. in the evening, which means that you have 1.5 hours to visit in the evening. And this will take effect immediately. Visitation outside these hours will be considered on an individual basis, and this depends on the condition of the patient or the person you wish to see, and if you're an immediate family or relative of that individual. Pediatrics, only mothers who are exclusively breastfeeding will be allowed to overnight. Initially, pediatrics had had open visiting hours. That will remain open. However, visitors will only be restricted to their parents. We will not allow children 12 years and under to visit. And that has been a rule for quite some time now. Some of these rules or some of these protocols, we will just be reinforcing. Having said all of this, we have done a number of changes, and I know they might seem quite sudden for you. You might even think that we are doing it at an inconvenience to you. We would like to ask for your indulgence at this time, simply because we need to help you as well too. As I indicated earlier, infection prevention and control depends on each and every one of us. All of us have a part to play. We have to protect our patients foremost. We also have to protect our healthcare workers, because if our healthcare workers are not healthy, they can't look after those who are ill. So we have to look out for our healthcare workers, and that by and large, we also have to ensure that the general public is also in good health as well. Dr. Hobson?
Good evening, everybody. As was mentioned before, I'm Dr. Florel Hobson. I work at the Outpatient and Emergency Department at the Alexandra Hospital. And I'm here tonight to just sensitize you to the way forward in light of the threat of coronavirus to our shores. If you do have a respiratory illness, that is cough, fever, runny nose, difficulty breathing, we're asking that you do not come directly to the regular emergency room during the hours our respiratory clinic will be functional. The respiratory clinic will be set up, as Sister Scarborough mentioned, at the gate, and this is the area we're asking you to come to. Or, if possible, call ahead at 763-5856. I'll repeat, that is 763-5856, and that is if you have any respiratory illness, cough, fever, shortness of breath, or if you think you may have been exposed to the coronavirus, or if you think you may have the coronavirus. So we're asking again, call ahead at 763-5856, or you will visit the gate to be screened if you have any respiratory illness, cough, fever, shortness of breath, or if you think you've been exposed to or have the coronavirus. If you do arrive at the hospital with cough, fever, or shortness of breath, like I said, the screening area will be at the gate when the respiratory clinic is functional. If you are diagnosed with coronavirus, COVID-19, it will be mandatory that you will be placed under isolation for 14 days. Like I said, mandatory isolation for 14 days for anyone who is diagnosed with coronavirus, COVID-19. However, on that note, if you are having a serious life-threatening medical emergency, you still can access care at the Alexandra Hospital Emergency Room. We're asking you to either get immediate attention, or you can call 469-5473 or 5474 or 5475 to connect directly with the ambulance. We can provide help, we can provide transport, we can provide advice. Again, if you are having a medical emergency, do not hesitate to seek immediate care at the emergency room, or call 469-5473, 5474, or 5475 to connect with the ambulance. Persons with minor complaints are asked to note that you will be expected to wait until a doctor is available to see your condition. Emergencies will be given preference, and like I said, all emergencies are asked to seek immediate care or call 469-5473, 5474, or 5475. If you do have a minor illness, the best advice would be to call your general practitioner, private family physician, or seek care at your nearest community health center. And this is for your safety and for your well-being, especially if our first case of coronavirus is announced. So if there is a case, you would want to avoid coming to the hospital if it is for something minor. Take good caution and take care of your problem at the nearest community health center or your family practitioner. We're also asking to note that regarding our other outpatient services, we would want to suspend our outpatient clinics, and that will be announced in the future based on if we do get a case. So listen out for that information. At the moment, we're taking only dressings for post-operative and fresh wounds. I repeat, we're taking dressings for post-operative patients and fresh wounds, and that will be done from 7 a.m. to 10 a.m. For persons with regular dressings, we're asking that you seek care at your nearest community health center. I'll repeat that one. For persons who need dressings, post-operative cases, and fresh injuries will be facilitated at the emergency room. Post-operative dressings and fresh wounds will be facilitated at the emergency room. For all regular dressings, we're asking that you seek care at your nearest community health center. Some other changes that you might notice if you have been to the hospital recently: there have been spacing of the chairs in the waiting area, and the chairs have been spaced 1 meter or 3 feet apart, and this is for your safety and your well-being. So we're asking that you not remove the chairs, keep them spaced 1 meter or 3 feet apart. Again, this is for your safety and your well-being. So we're asking for your understanding and your cooperation during this time. All of these changes are to benefit you, the general public, us, the caregivers, as well as our patients who are all vulnerable. So we're asking for your understanding and your cooperation with these changes. So we just came tonight to sensitize you. You might see some things that are new, some things you have never seen before. Please try and cooperate with all the changes. When you're given instruction, please try and understand why we're doing this. For your safety, for your protection, for our protection, and for the protection of our patients. Thank you.
All right, very well. Now, Pemberton, you wanted to get back in to say some?
No,
Yes.
I would just like to endorse what both Nurse Scarborough and Dr. Hobson has said. We are just craving the indulgence of the general public as we make these changes. These changes are mandatory because we want to protect our staff, and we want to control the spread of infection, because we don't want to have an outbreak on Nevis. It's a small population, and if you do have an outbreak, it will be something that we may not be able to manage. So we're trying to put the preparatory things in place to prevent these things from happening. So we just want to encourage the general public to be understanding as we go through these changes.
I just wanted to reiterate. So if you're having an emergency, you come. If you're having an emergency, you come. You have a fresh injury, you come. At any time. Just want that to be clear.
Let me just say here too, in terms of infection control, we do have a designated vehicle for persons who may not be able to get themselves to the hospital once they would have called, who would have probably had signs and symptoms of COVID-19. So you also can call for assistance in that regards.
Okay. You've emphasized a couple of numbers that people should call for varied reasons, right? And I noted 469-5473 or 74 or 75, correct?
Yes.
I always have to ask the difficult questions that people would want to ask. Do we have a guarantee that those numbers or calls will be answered?
Yes, we are guaranteeing that those calls will be answered, because as it is now, we have this coverage at the switchboard up until 12 p.m. So once
12
you call
midnight.
12 midnight. So
Right.
once you call, those calls will be answered, and it will be transferred to the necessary area.
The testing, we spoke a little about that, and I suppose that the question will be, do we have the necessary kits to test persons who are suspected of having, the coronavirus? Do we have the test kits on Nevis?
So as with any other infectious disease, this is the responsibility of the Public Health Department to ensure that testing is done. So we do have the ability to take samples and we submit them to the Public Health Lab and they process the samples and send the result back to us.
The public health lab where? Because we know that, for instance, if we're going to do a urine test, you know, we know it's done at the lab, right?
Right.
So this particular test.
The Caribbean has a central
Okay.
public health lab.
Mhm.
So that is where we submit all infectious diseases, all. For the
Okay.
past, how much ever years it has been in existence. That is the protocol. We
Oh.
send to the Caribbean Central Public Health Lab, and they'll process the samples at no cost to the patient, and then we get back that result.
So, okay, so we
And so the Public Health Department will be responsible for that.
okay, so we go to the hospital at the lab. They take the samples, and you send them off.
If you report to the hospital, either respiratory clinic or the outpatient physician, if you are suspected to have coronavirus, COVID-19, then there's a number of steps that we'll follow. So if you do need to be tested, the testing will be done at that moment.
Okay, and then you know everybody is anxious about this particular virus. Do we have a timeline in which we can know the results?
The
If we send them off to the where we normally send the samples, is it a day, a week, a month, what?
Well, there actually is a private lab in St. Kitts that for the COVID-19, they can do the test. So, and you will be able to get back results within 4 hours.
Okay,
But we have to
good.
take 2 samples. One is sent to the private lab in St. Kitts, and then the other one is sent off to CAFA
Okay.
for confirmation.
All right. So in a matter of hours, maybe, you know, a day or two, people will know.
Yes.
We will know. Okay. Because I think that's one of the things that people get anxious about, right? Now, the doc, you mentioned certain symptoms, and I noted in one of them you said shortness of breath and the fever, and those two are two of the main ingredients, if you will, for this particular virus.
Not necessarily the main, but we pay special attention to that.
Okay. Well, let me ask this: Can one tell? How do we know the difference between an ordinary flu, which we normally get sometimes every year, you know, or seasonal, as opposed to this particular COVID-19?
They are all viruses, and usually the symptoms that you get when you get a viral infection sometimes is not due to the virus, but your body's immune system response. And so for any viral infection, it may be difficult to differentiate just on symptoms alone. So there's other things we're taking into account, such as the travel history and exposure to other persons.
Mm-hmm. So let's use a hypothetical. So someone feels ill tomorrow, not terribly ill, but they feel perhaps they're seems like they're getting a little fever, and they don't feel so well. Should they call the doc or something?
Yes,
Mm-hmm.
call ahead.
And said, you know, just describe
And then,
this.
and then a question, a sequence of questions can be asked further to get a clear idea of what needs to be done. So best advice is, if you are feeling ill, call and ask a question.
Mm-hmm. How about, you know, sometimes in the workplace, there might be a coworker or somebody who is coughing, but that normally happens, you know, on a weekly basis. Somebody gets a flu or cold, but everybody is anxious these days. So,
In general, if you are coughing, you should not be at work.
Mm-hmm.
In general, hygiene and etiquette dictates. In general, if you're
Yes.
coughing, you should not be at work.
And especially around this time, right?
This time or any other time.
It should not be.
You should not be at work.
All right, well, if I
Yes.
could jump in here as well, I'm sure the doc will back me up. The PAHO has a list of protocols or guidelines that we will use when we are assessing the patients, and I'm sure Dr. Hobson will be able to go through it, but there's a list that we will go through, and if you meet the criteria based on the list, then we can tag you as being a suspect based on what we have on the protocol.
The Premier had said in his address yesterday that we have a specific area that we'll be using. Do we know if that area is ready yet, as far as quarantine in persons and so on? Do we know if that area is ready yet? I don't know if it is you are the right person to ask that question or him, but do we know?
Well, that is, as Dr. Hobson would have indicated, the public health officials are the one who really will be dealing with these things. We're just specifically dealing with our operations at the hospital.
Do we have, are we preparing for numbers? When I say numbers, when we listen to the radio and the television in the United States and so on, we see as one case happens and then, you know, it begins to multiply and so on and so forth. We're a small community, the resources are very limited. How are we doing in terms of preparation for some numbers?
In terms of preparation for some numbers, the area that we have identified for isolation, there is capacity for expansion in that particular area. So let's say, for instance, we are catering, or we have like 5-6 beds allotted. The particular area we have can be extended to just a little more than that. It will be difficult because human resource will be extremely difficult for us. We're not going to underplay that. It will be difficult, but we're all here to help each other. So I would think that we're all prepared to do what we have to do to get us back into a healthy state.
Under normal conditions, again, as you said, we know what the real situation is. Under normal conditions, we are almost stretched for health workers, nurses, and so on and so forth. Are we, Doc, are we getting any extra help from anywhere, or we have to just stretch the resources that we have?
I'm sure that will be assessed on a needs basis, and the decisions that will have to be made at that time.
Well, for starters, we would have touched base with our retired nurses. So some of them have come back into the system to assist us in terms of if we need help, additional help. So we have making use of our retired nurses. And just this evening, I'm hearing that it's a possibility that we might be getting outside assistance if necessary.
Now, do we, another hypothetical, so going forward we learn we get 1, maybe 2, let's say about 2-3 cases. Do we, having identified them as, you know, the coronavirus, do we keep any of those persons at the hospital?
It would depend on their condition, Webo. For those with mild symptoms, and I think I think it's 88%,
yes.
88% of persons who would develop COVID-19 would be mild, would be a mild case of COVID-19. So most of the time, more persons may not be admitted. Only severe persons in severe respiratory distress would be admitted to the hospital.
Doc, we're learning, you know, as we get information internationally and so on, we're learning that one of the first things they do, they put you in quarantine for 14 days. When that is done, is there treatment going on at the same time?
Quarantine, I think the wording might be incorrect.
Symptomatic.
Quarantine is for asymptomatic, non-ill patients. Isolation is for inpatients.
Right. If
So if you are isolated, then you will get whatever treatment you will warrant.
right,
Based
here's
on the case.
yeah, here's a question. If you have been identified as being a case, if I'm identified as having the flu, the doc normally gives me a prescription, and over 10, 14 days, that should take care of that. If one were identified with to be identified with this COVID-19, then what?
Then the public health officials will need to be notified, and then we'll take it from there in terms of where they'll be treated, how they'll be treated. It depends on the case.
Mm-hmm.
It would depend on the individual case.
But let me just say here, Webo, that there's no treatment for COVID-19 right now. They are you're being treated for symptoms. So if you have a fever, you get something for the fever. If you have a headache, you'll get some analgesics for the headache. So whatever symptoms you present, that's what we will be treating at the moment.
And that's why it is awfully, important that people try to put the certain measures in place that they're advocating. Hand washing and the distance and so on.
Right. Hygiene is very important.
Personal
That's
hygiene.
the number one way to prevent yourself from getting a viral infection of any sort. Gastroenteritis, influenza, hand washing.
Yes.
Very important. Personal hygiene, very important.
And not just hand washing either. You should wash your hands for at least 20 to 30 seconds.
Proper hand washing.
Proper hand washing, yes.
And for persons who are ill, etiquette, like I said, if you are coughing to a tissue, discard it immediately, or cough into your elbow if you don't have one available.
Some people are of the view that because it has not been declared that we on St. Kitts and Nevis we have any identified cases as yet, then perhaps maybe we should not start those rituals as yet. Correct? Are they wrong?
No, they're incorrect. You cannot wait until you have a case to start to prepare. You must prepare in the eventuality of a case. So once the case comes up, then we are ready to deal with that case.
Okay. If you're just joining us, we're speaking with health officials of the Alexandra Hospital, Dr. Hobson, Assistant Matron Jessica Scarborough, and Administrator Gary Pemberton. We are talking about the changes that they have put in place at the hospital, temporary changes to deal with the coronavirus situation. And we're standing by to join live the ZIZ Broadcasting Corporation to bring you Unity Government's Town Hall meeting from the Newton Ground Primary School on St. Kitts. So we're just standing by and we'll go there live. Yes, Gary?
Okay, maybe what we can do, Weber, is to allow Nurse Scarborough to just go through some of the changes that will be implemented with immediate effect at the Alexandria Hospital.
Okay, with immediate effect, visitation to the Flamboyant Nursing Home and the hospital, the Alexandra Hospital, will be restricted to family members and caretakers only. Visitors will also be limited to one patient, so that is one visitor to one patient, and that visit should last no more than 10 to 15 minutes. If you are visiting, you will be required to log into our visitors logbook. We are asking that you provide all the necessary information that this login sheet would ask, which would include your name, your address, your contact number, the name of the person you are there to see, the ward that the person is on, and we're asking you as well to sign in and sign out. You sign in the time when you would have come, and you sign in the time when you would have been leaving. Our visiting hours, which was 5 hours, previously, has been shortened to 1.5 hours. That is, it is no longer from 3 to 8 p.m. It will be from 4:30 to 6 p.m. on evenings, with the exception of Tuesdays and Thursdays, which we don't have any visitors because that is our operation day or surgery days. Visiting hours outside these hours will be considered on an individual basis, and that is dependent on the condition of the patient, condition of your relative in hospital if they're critically ill. For children's ward, mothers only mothers who are exclusively breastfeeding would be allowed to stay overnight. We're also limiting visitors on children's ward to parents or immediate guardian and parents only. No children under 12 years old will be allowed to visit. That is something that has always been in effect, but we will be reinforcing that at this particular time. If you are ill, you are asked to call the hospital before you come. The numbers are 469-5475, 469-5474, and 469-5475. Once you arrive and you have a cough, a cold, a fever, or you are sneezing, you will be given a mask to wear. We're also asking you, if you have any one of these symptoms, any respiratory symptom, we are asking that you go straight to our respiratory clinic, which is located at the gatehouse. Instead of coming to the emergency room, you go straight there where you will be assessed or screened. And then that health personnel will determine what to do with you or where to send you after. For immediate medical emergencies, you are asked to call the hospital if you need an ambulance, or you can turn up at the emergency room. If you have signs and symptoms of COVID-19 and you need transportation, we do have a designated vehicle for that. You can call the numbers that we would have given you, or call the number that would be situated or located in the respiratory clinic, which is 765-5658, and that particular vehicle will be dispatched to assist you as well.
763-5658.
That's the message. Yeah.
763-5856. Sorry, 763-5856. That's the number for respiratory personnel.
Now, during this time, we are craving your indulgence to cooperate with us. We are looking out for you. We are trying to help you, and we are also looking out for our patients and our healthcare providers. Thank you.
All right, Dr. Hobson, you just want to go to the flu clinic and let them know where that will be located and how they can get attention?
As Sister Scarborough mentioned, anybody with cough or other respiratory symptoms, cough, fever, shortness of breath, you're asked to check in at the gate, and this is where our respiratory clinic will be located. If you are at home and you think you may have been exposed to coronavirus, COVID-19, or if you think you do have the virus, we are asking you to call 763-5856. The person answering can provide medical advice, and transportation and treatment, if needed, can also be provided by the Alexandra Hospital. If you do arrive at the hospital with fever, cough, and respiratory symptoms, like I said, you check in at the gate. If you are diagnosed with coronavirus, COVID-19, it is mandatory that you be isolated for 14 days. If you're having a medical emergency, a life-threatening emergency, a serious emergency, do not hesitate to call 469-5473, 5474, or 5475 to get the ambulance, or you can turn up at any time and seek emergency care. There are persons that will be available to treat emergencies. Persons with minor complaints, we are asking that you seek care at your private physician, family doctor, or nearest community health center to avoid turning up at the emergency room. But if you do turn up, be prepared to wait.
So in essence, the cases that appear to be, you know, when you have these symptoms, the best place to call are numbers at the hospital. And then if you have irregular issues and so on and so forth during the day, you can call the health center.
Right.
Or your private physician.
Okay, so are we? Can the population be assured or comfortable that at least the hospital is making the necessary preparations and adjustment for?
Yes, we want to assure the general public that we are doing our utmost best to prepare in the event that we have a case. There's no situation is perfect in terms of the services that we can provide, but based on the circumstances and based on what we are able to provide at the hospital, we are making the necessary preparations, and we are assuring the general public that once you come to the Alexandria Hospital, we'll be able to give you the best service possible under the circumstances.
Okay, and Doc, before we go, you I think you had mentioned earlier that some of the cases for dressing and so on and so forth.
Yes.
So can we go over that again?
Yes, we'll go over that. So dressings for persons who are post-operative, so you just had surgery and you need a dressing done. Dressing will be from 7 a.m. to 10 a.m. at the Alexandria Hospital outpatient department, as per usual. Any fresh wounds, fresh injuries, you can come at any time. You'll be seen as an emergency. For those who have regular chronic dressings, we ask that you seek care at your nearest community health center.
Okay. And so we're going to be wrapping up because as I said, we're standing by to go to the live town hall meeting. So matron, assistant matron, any other comments?
And at this time, I would like to implore on the general public to practice their personal hygiene, good personal hygiene. You wash your hands, cover your sneeze and your cough. Hand sanitizers, make sure you have an alcohol-based hand sanitizer on you at all times. It may not be as good as soap and water, but it will do in the meantime until you could get to running water and soap. So make sure you have your hand sanitizers. If you are ill, please don't hesitate to call any of the numbers that would have been provided. If you're not sure which number to call, you can call the straight line, which is 469-5473. One of those lines, and we will be happy to direct you to the respiratory clinic if that is where you need to be. If you need transportation to the hospital, you're not feeling well, you don't have any transportation, we can provide that in both instances, both in medical emergencies and in this case, if you suspect that you would have been exposed or you have COVID-19, we can transport you to the hospital as well if needs be. But we are also asking your indulgence in these new changes in terms of the visiting hours that we would have put in place. We are also asking you that, we be very considerate, especially to our elderlies at the Flamboyant Nursing Home, because I know everyone knows that the elderlies are very susceptible based on statistics in terms of COVID-19. So we would really like us to look out for them. I am also asking as well that we cooperate with the personnel at the hospital. If we are required to log in, that we please log in. We ask you to log in for your protection as well too. If any illness is, let's say any illness emerges, we are able to do contact tracing, and that's one of the main reasons why we are establishing a login at the hospital. So at this time, I would like to thank you in advance for your cooperation, and please don't hesitate to call if you have any questions.
Mr. Pemberton, how about supplies? Because everybody sees that some countries don't have, whether it is the mask for the nurses, etc., etc. How about our stocks?
Well, we have been stocking up on the necessary supplies. What the public need to understand, some of these supplies that we are stocking up on, these are things that we use on a regular basis. It just because of this situation, we might be using more on a more regular basis. So we have been stocking up on the necessary equipment and supplies that we would need to, in the case that we have to deal with a situation like this.
Okay. Anything further we just want to underscore?
Before
Yes.
I leave, I would also like to point out to the general public that masks are really supposed to be used for persons with symptoms. If you're working in a healthcare facility and you're looking after somebody with symptoms such as cough, sneezing, cold, you would be required to wear a mask. But masks are supposed to be worn by persons with symptoms. And we are also asking that you wear them properly, because we have seen persons who are wearing masks on their foreheads and on their chins. And they stand the chance or they're risking their health even more by wearing these masks wrongly. So that is something that I think we needed to point out tonight as well.
Well, maybe that's the light moment for that this, because sometimes people wear shades on their forehead too. So, yes, Doc.
Okay, so what I would also like to leave with you is that coronavirus, COVID-19, is not a death sentence. I think some people might be thinking that if you contract the virus, you will die. That is not the case. 91% at this point of persons who have been infected have had full recovery.
Yes.
That is 91% of persons who have been infected have full recovery. I would just like to leave that.
Okay, and that's very important, because I don't think that statement
Has been
that you just made has been getting through a lot. You know? Yes, Gary?
No, I just want to back up what Doctor would have said. Yes, it is important that, as she said, 91% of the persons who are infected, they have recovered, and that is what we want the general public to take from this discussion, that you can recover, or you will recover from the coronavirus if you get it. So it's not a death sentence, as some persons probably think. It is a matter of sensitizing the public, give the public the necessary information. I'm sure they will be guided accordingly.
And nurse, how you wear the mask again?
Your mask is supposed to be worn around your nose and your mouth.
Okay, well, we thank you very much for coming and giving us the guidance and the update. And please, if necessary, please come again, as you know, things may change. And
Yes, definitely.
and we have to do the adjustment. So, Dr. Hobson, Assistant Matron Scarborough, and Administrator Pemberton. This program repeats tomorrow at 10 o'clock following the VON News Minute. Join the Honorable Mark Brantley tomorrow evening at 8 o'clock for On the Mark. Thank you all again for joining us. Your voice in the community, talk that get results. We'll be standing by to join ZIZ Radio to bring you Unity Government's Town Hall meeting live from the Newton Ground Primary School on St. Kitts. You all have a wonderful evening.
Doors. Builders Paradise has cheap 4 and 6 panel knotty pine doors starting at $224.99. That's right, $224.99. Sizes such as 24 by 80, $224.99. 28 by 80, $235.99. 30 by 80, $240.99. 32 by 80, $249.99. And 36 by 80, $259.99. We continue to be the largest supplier of doors in the Federation, so visit us today so you can purchase that desired door. Visit Builders Paradise today at the C.A. Paul Southwell Industrial Site St. Kitts, or call them at 466-4938 so they can help you complete your home. Builders Paradise, where your island dreams come through.
Expressed on the preceding program were solely those of the participants and do not necessarily reflect the views of the Nevis Broadcasting Company Limited or its advertisers.